Mommy Track Daddy Whispers podcast is now called Birth Agni Podcast.
Welcome to Mommy Track Daddy Whispers podcast, Season 3.
And the husband was able to convey to the doctor that she will try for some more time. And actually what happened after like 1 hour, she got dilated. There is a developing baby and the developing fetus, so the abdominal area is totally accommodated by the fetus. And developing fetus कहाँ पे pressure डालेगा? वो सारा जितना भी pelvic floor muscles हैं, which are down below, which are placed there as a trampoline. So उन muscles पे जो baby weight है वो सबसे ज़्यादा वहीं पे ही pressure बच्चा डालता है.
Hello, you are with me, Divya, on part 2 of our conversation with Dr. Divya Gaur, a physiotherapist, a certified antenatal, postnatal exercise specialist, who talks about pregnancy, exercise, and its effect postpartum. We are continuing our conversation further to understand the effect of pregnancy exercise during postpartum. And I know I have been missing from the internet space, online, social media, not really being present, talking to you. The last one episode was also delayed. There is a good news. I shifted to a new place and been really occupied. Settling down here, it's lovely. I will be sharing pictures on the Instagram for the details of the shift as soon as I find time. As well as Divi joined a school and she's occupied for a good 3 hours in the day, which gives me some solace. She comes home learning new things, so that is also a breather. So good things happening, new phase of life, which is why there were some delays, and I absolutely apologize for this. There is one more news. I will be putting the pregnancy series on hold for 2 weeks, which means that the next 2 episodes of the biweekly pregnancy series will not be there. And I will continue the seasonal episodes. The next one is going to be a very significant one. So let's continue our conversation with Dr. Divya Gaur, and more on that to follow at the end of the episode. So let's begin. So Dr. Divya, we were talking about urinary incontinence in pregnancy and postpartum. And we were talking about Kegels, that these are the exercises that help, strengthen the pelvic floor. Yeah. So is there some other way as well that we can prevent leaking of urine in pregnancy and postpartum?
There are a lot of ways by which we can prevent. So one is by having lesser amount of carbonated drinks, coffee and tea. They make you feel like you need to urinate more often. So we need to cut down. And pregnancy में वैसे भी carbonated drinks and tea and coffee, it's been said that it leads to lesser absorption of iron and it makes lesser amount of hemoglobin. So it's important to cut down on the carbonated drinks. And in the postpartum period, of course, अगर आप cut down करोगे तो you'll have the need to go to the washroom less often. So this is advised. And you should also work upon reducing constipation. So if you feel that you get constipated more often, then you should eat food that are high in fiber. And that of course, while you're constipated and you're putting pressure on your abdomen, तो उससे भी urine leak हो जाता है कई बार. तो इसलिए work on constipation. That will again lead to less leakage of urine. And maintain a healthy body weight, because extra amount of body weight can put extra pressure on the bladder. Right. So losing weight after your baby is born can also help you to relieve some of the pressure on the bladder.
All right. So that means we need to also understand that it's not just urinary incontinence in pregnancy, is also because of the amount of pressure that's there on the bladder, on the pelvic floor muscles that are holding everything up. So it's important to make sure
Yeah,
that
absolutely. Yes, absolutely. You got it right.
so we need to work on making sure that they are not additionally burdened in
Yes,
pregnancy.
yes. In the pregnancy state, of course, we know that there is a developing baby and the developing fetus. So the abdominal area is totally accommodated by the fetus. And developing fetus कहाँ पे pressure डालेगा? वो सारा जितना भी pelvic floor muscles हैं, which are down below, which are placed there as a trampoline. So उन muscles पे जो baby weight है वो सबसे ज़्यादा वहीं पे ही pressure बच्चा डालता है. So what happens is that it leads to stretching of the pelvic floor muscles, and of course the muscles get weak. That is why we need to do Kegels in the antenatal period, because the weight of the developing baby also can lead to dribbling of urine. And apart from that, there are frequent visits to the washroom because the bladder is getting lesser space now, because the space that is accommodated in the pelvic floor area by the uterus, by the urinary bladder, and by the rectum. So they are in one line from front to back. If we talk about, there is urinary bladder, there is uterus, and then there is rectum. So they are in one line. So if at all we know that, the uterus is now full with baby, so the bladder is getting lesser amount of space. And जैसे ही bladder थोड़ा सा भी full होता है, the pregnant female feels the urge to go to the washroom. So that is also a reason. And also because of the developing baby, there is a lot of pressure on the pelvic floor, which makes it weaker. So again, that can also lead to dribbling of urine. So सबसे पहले तो Kegels हमें करना शुरू पड़ेगा in the antenatal period, pregnancy state में, so that कि postnatal period अच्छा जाए.
So this answers my question that exercising in pregnancy suffices the postpartum recovery, suffices for the postpartum recovery.
Yes, absolutely.
And I was also reading this study. I'll just take it out. That said, just a moment. There was this study by the British Journal of Sports Medicine that said the conclusion of that study on the prevention of urinary incontinence said that prenatal exercise, including pelvic floor muscle training, reduced the odds and symptom severity of prenatal and postnatal urinary incontinence. This was the case for women who were continent before the intervention. That means they did not have the incontinence. Among women who were incontinent during pregnancy, exercise training postpartum was not therapeutic. Have you seen similar examples in your practice, or has exercise really been able to reduce the urinary incontinence for women who were already leaking urine?
Yes, many women actually, many women. But then, yes, they have to start early in the postnatal period. So that is the main thing that we need to learn here. Learn or maybe start doing exercises, specifically Kegels. And apart from Kegels, बहुत सारी ऐसी एक्टिविटीज होती हैं. फॉर एग्जाम्पल, जब एक मदर अपने बेबी को लिफ्ट कर रही है एक हाथ में और दूसरे हाथ से उसका स्ट्रॉलर लिफ्ट कर रही है, और मे बी द कैरियर, शी इज लिफ्टिंग द कैरियर इन द अदर हैंड, then also it leads to extra amount of load on the pelvic floor. So she needs to engage her pelvic floor every time she is lifting the baby in one hand, whenever she's multitasking. So we have to provide knowledge to them in the prenatal period about all those things, क्योंकि postnatal period में life एकदम से change हो जाती है. Right. Because you have baby and then you have to work with the baby and in lot many ways, while you're bending down to change the diaper, while you are actually bending down and you're being in that position while you're bathing the baby. So there are a lot of postural changes also happening in the postnatal period, and every time you are in a stressful posture, you have to engage your pelvic floor. So अगर early in the postnatal period अगर हम work कर रहे हैं, then it is not going to lead to like further deterioration. It is only going to get better. And yes, like women who were incontinent in the antenatal period because of the pressure on the pelvic floor, they got better in the postnatal period by getting all the knowledge and by following exercises in the postnatal period. So early in the postnatal period, ये सबसे ज़्यादा important है कि 6 weeks जैसे ही खत्म हो, जैसे ही the female feels better about her body, she feels confident about her body that she can now do the exercises, she feels comfortable and the pain is not there. So जैसे जितना जल्दी वो शुरू करेंगी उतना जल्दी ही she'll be able to recover faster. And मैंने बहुत सारे old women ऐसे of course elderly females at home जिनको हमने देखा ही है कि जब भी वो घर से निकलते हैं, निकलने से पहले they use the washroom, and if they have to travel for long distances and while traveling also they ask for that we need to stop somewhere because they need to go to the washroom. And there are many females who avoid going to places and they ask कि कितना time लगेगा, just because of the reason, because अगर वहाँ पे washroom नहीं हुआ, they are going to feel uncomfortable with that situation. And many a times I have seen कि बहुत सारे trips तो बिल्कुल cancel ही हो जाते हैं, because this is like a big big reason. Yeah, it's a big challenge and a big reason why they avoid going to places where the availability of washroom is not there. So elderly females को अगर हम पहले से इन चीजों की awareness होती, so I'm sure that they must have not reached the stage जहाँ पे they actually consider this as a part of their life now. So बहुत सारी females in the postnatal period यही सोचते हैं कि this is like a part of their life and this is a lifestyle change that has happened to them. This is normal part of giving birth to a child. So they consider it as normal, but this is not normal. A pelvic floor physiotherapist can help you get better, and they can tell you a lot of exercises and lifestyle modifications as well, so that they can get better and get going with the changes that they have come across through the years.
That reminds me that when we were starting this entire theme for this season, that a friend talked to me about her mother's condition, that she's not able to hold urine, and she had great back pain postpartum, and that's when she went to a physiotherapist, and the physiotherapist helped her figure out ways to strengthen her pelvic floor. And we while we were talking, we realized that the awareness needs to be there, that this is not normal, and it can actually aggravate to when your muscle strength is reducing as you age. So that's a very important thing that you brought out, and it's very important to talk about it, and that was the reason that we started this entire theme for this episode.
Actually, Divya, सब कुछ ही connected है. Right. So the diastasis recti that happens, it is also connected to the dribbling of urine. So our core in all, that is the back muscles, our diaphragm and the abdominal muscles and the pelvic floor, they should work together so that we have a stronger core. Everything is linked together. So it's very important to work on core. सबसे पहले तभी बोलते हैं कि breath work पे work करो, because it starts to engage each and every part that builds the core. So specifically we should start with the breath work in the postnatal period, जिससे कि सारी muscles ना engage होना शुरू हो जाएं. धीरे धीरे जैसे वो engage होंगी muscles, they are going to get back into working early in the postnatal period.
And it's amazing that we don't realize that breath work can also engage your muscles. It's
Absolutely. We do not realize that a simple thing, learning a simple breathwork technique, can lead to a lot of changes in our body, and it can actually prevent the leakage of urine. It can also help you to recover, or maybe initiate your body to recover for diastasis recti as well. So for that also, the breath work is very important to engage your abdominal muscles, get them to working specifically.
Yeah.
So yeah.
It was really insightful to talk about these small nuances here and there that are important in pregnancy and early postpartum. Now, before we bring our episode to an end, I would also like to ask you. I would also like to ask you: are there some exercises that are counterindicative, as if they should not be done in pregnancy or postpartum?
So the exercises that we should not do in the antenatal period, one is high intensity exercises. But when I talk about doing mild to moderate exercise, that accounts for a lot of exercises. So बहुत सारी exercise हमारी उसमें include हो जाती हैं, and there are a lot of options also for a pregnant female to do all those exercises in pregnancy.
So, what are some of the warning signs that one should be wary of when exercising in pregnancy? Now that we've already discussed the exercises that are counterindicative. So, what are the warning signs?
So let's talk about the warning signs that you have joined the prenatal fitness classes. You are now 4th month or above, and you have joined the fitness classes. And now let's talk about when to stop exercising. What would be the warning signs? So one is vaginal bleeding, abdominal pain, regular painful contractions. If there is any leakage of the amniotic fluid and you feel dyspneic, then also you should stop exercising there and then. If you feel dizziness, if there is any headache or chest pain, if you feel any kind of calf pain or swelling, then also you should stop exercising. So these are all the warning signs.
All right. And Dr. Divya, before we let you go, and since this was so important, we all want to do so much in pregnancy to ensure that the baby is healthy, that we are healthy, that we have a good recovery. It's also very important to know when to stop, when to listen to your body. So it was great to know those warning signs. But before we let you go, I really wanted to ask you about a recent case from your clinic that you would like to give reference to, in the terms that it helps our listeners get an understanding of how and why prenatal exercises, postnatal recovery is important. Maybe something that you want to tell our listeners, so that can be covered in there. Do you think knowledge about these signs, knowledge about pregnancy health is important, is significant? And what have you observed in your practice?
Knowledge about pregnancy health is very important, but most important thing is that you should get it from the right source. That is actually more important. So consulting a pregnancy care physiotherapist or a childbirth educator, so that should be your first point of contact. Then also your care provider, that is your gynecologist. So these are the correct kind of healthcare providers you should go to, but you should not rely on Google. So there are a lot of things which a pregnant female is confused about, whether we should exercise during pregnancy or not, how many minutes is okay to exercise. So ये सारी चीजों के बारे में we should go and check with the gynecologist or the childbirth educator or an antenatal postnatal exercise specialist. उन्हीं के पास जाके हमें इन सारी चीजों की एडवाइस लेनी चाहिए. गूगल पे तो बिल्कुल रिलाई नहीं करना चाहिए. दैट आई थिंक इट्स नॉट अ गुड सोर्स टू रिलाई ऑन, because there is a lot of information that's floating on Google, but it's not necessarily from a practitioner or a healthcare provider that you should rely upon.
Yeah, an individual.
Yes, yeah. Exactly. It's according to one's individual perspective, but then you should talk to your doctor, your gynecologist, your childbirth educator, and there are many nowadays, as there is a lot of awareness about around this field. There is a lot of awareness also happening. So you should talk to the correct person. That's very important.
Yeah. And if you could tell us about a recent case from your clinic, just to give reference to our listeners upon what is important, what is significant when it comes to prenatal and postnatal exercise or recovery. And maybe something that you just want to tell our listeners.
Actually, Divya, there are a lot of clients that I've mentored and a lot of strong women that I've mentored. And I had a client, she was from Chennai, and I mentored her throughout. When she was in the labor phase, unke husband, he had to travel like from one place which was like 2 hours away from her. So during that time, her mother was available with her. And her mother, actually, she was very strong, so it's very important to have a good support partner also along with you at the time of labor. And a good support partner, apart from a childbirth educator, can make a great difference in the outcome of your birth. So her mother was very strong, and she told her that you're going to experience labor pain, and after like 3 centimeter dilatation, her labor got stalled, so there was no progression further. For the next 4 hours there was no progression. But then of course she went strong. We had a discussion call, and I told her that, keep working on your body. This is the only time that you have to keep working, and you are going to achieve the dilatation. So I told her to calm down. I told her to listen to some relaxation music, and I told her mother also. And her mother was very strong, and she also helped her in that situation. Then in the meanwhile, her husband also arrived in that hospital. So it made the situation under control, and the husband was able to convey to the doctor that she will try for some more time. And actually what happened, after like 1 hour, she got dilated like to 6 centimeters. And then of course it took some more time to get dilated to 10 centimeters. But a support system really works. And she eventually led to a vaginal birth. That was a great news for me, because mentoring someone from Gurgaon to Chennai, it's like a long distance thing. But the first thing like after she delivered her baby was, she told her ki Divya ko call karke batao that I delivered vaginally. So her mother called me that Divya, Anusha has given birth. So that was actually very satisfying, when the first person who comes to know about the birth is you.
Yeah.
So that's actually a great feeling. And a lot other as well. So whenever, of course, whether it's a cesarean birth or a vaginal birth, so most of my clients, I would say like each one of my client, they tell me about their birth experience, which is very important for me, because all through the antenatal period हम यही discuss करते हैं कि कैसे problems को solve करना है, how we have to stay strong headed, how we have to work on our bodies, and how we have to improve strength, so that जब actually में the days is going to arrive on the labor day. So that day, of course, we have to gather all the strength and all the work that we have done through the 9-month period, so that कि वो दिन जो है पूरा energy लगा दो, and it's like a marathon. That you're working for the marathon throughout the 9 months, and then you have to deliver, you have to work on your body on that particular day. You have to show what you have done, and you have strengthened, and what you have worked upon your body through that 9-month period. And
support system is really important.
Support system is really, really very important. And the second important thing that I tell all my clients, and I make them learn this thing, that your body is capable of taking the labor pain. So we women are made, and we are so strong that we are capable of taking the labor pain and giving birth to a child. So giving birth to a baby is something, it's like working for God. That's what I think. Women are really very strong, and I tell all my clients that labor pain is something जो आप ले पाओगे, and don't fear taking the labor pain. So सबसे पहले इसी चीज पे वर्क करना और बताना इस चीज के बारे में बहुत जरूरी है, बिकॉज मोस्ट ऑफ द फीमेल्स व्हाट हैपेंस इज दैट ये सुन के ही फ्रॉम देयर फ्रेंड्स और फ्रॉम देयर रिलेटिव्स की लेबर पेन होगा, and when they talk about कि ये तो बहुत painful होता है, so suddenly from the experiences of the females who have already given birth to a kid, वो सुन के ही लगता है उनको कि ये तो ना हम नहीं ले पाएंगे, ये तो होगा नहीं, ये तो कुछ बहुत ही painful सी चीज होने वाली है हमारे साथ.
True.
So it's very important to tell them the fact that it would be painful, but there are lots of ways by which we can handle the labor pain very beautifully, and you can take on and you can work on your body to take the labor pain and of course be confident about it कि मैं ले पाऊंगी ये.
Right. That's absolutely amazing what you've said, and these two important points that actually help women go through this experience on a positive note, that you have it in you, and your support system matters. So, build that support system, learn, educate yourself. Whenever you have a problem, go and talk to a physiotherapist, a gynecologist, or a birth educator, or a lactation counselor, whoever you think is important. Thank you so much, Dr. Divya. That was an amazing conversation. So much to learn. And I think before we leave, on the last note that you said reminds me of a friend. She was really scared of the labor pain because her mother had a very, very painful labor experience. And she was like, Divya, what will I do? And then she underwent childbirth classes through the hospital. And her labor was an hour long, and she did not even realize she was in labor. And she birthed a baby in an hour. And I was like, it was such a heartwarming experience.
Oh my God.
Yeah, and she was talking to me while she was in labor. We were just discussing. The last discussion we had was that I'm really scared. And then the day she was in labor, she said, oh, I know everything about it. I am okay. I don't care what happens. Let's just see what happens. I'll be able to do it. I think that kind of perception is also extremely instrumental in your birth story. It helps you.
Very important, yeah.
Yeah, and when she told me the next day, she sent me a picture of the baby, and she told me, I had delivered yesterday after I had a word with you, and I realized I'm in labor. It was immense. I think these are the kind of testimonies we need to talk about more than the fear of the labor, the success stories that are out there. Thank you so much for sharing that.
We need to talk about the success stories. That's absolutely correct. Thank you so much, Divya, for having me today. It is actually an honor for me for being on your channel. And thank you so much, Divya. It was wonderful having a conversation with you.
Thank you so much. We share a name. So much to share too.
Now we share a name. Yes.
Thank you so much, Dr. Divya. It was wonderful to have you. Thank you.
Thank you.
So this was our effort to understand the importance of pregnancy exercise, its effect postpartum, its effect on urinary incontinence that is less spoken about, and various other issues that women face postpartum. And there is so much that we can do early postpartum to help ourselves recover better in the days to come. The initial phase of postpartum is really significant, and that is where this information comes handy. Thank you so much for being with us today. If you really like what you listen to, do consider giving us a rating on Spotify. Do consider giving us a review on Apple Podcasts. It does help us get found. It does help relevant information get to newer listeners. It helps the community grow. Thank you so much there. And in the next episode, we are bringing a topic that is really less talked about, like so many topics on this podcast, and that is vaginismus. Vaginismus in women before pregnancy and post that with Dr. Nivedita. Stay tuned for that episode. The next 2 pregnancy series episodes are going to be on hold. I am reminding you of that. And it will be back after about 15 days. Thank you so much for being a part of this community. Lots of love. Stay tuned.